Okay, so do you want to introduce yourself, Dr. Salles?
Okay. Hello, everybody. Good morning. Here, Brazil, early in the morning. It's a pleasure to be here talking about ARVO meeting and information about what is working, what is happening in research for Stargardt and ABCA4 gene. And I will talk a little about my work. I'm an ophthalmologist, and I start to study about Stargardt's case since 2012 here in São Paulo at the Federal University, the Unifest, nearby Dr. Mariana Salles. And I started my PhD at that time. In 2012, and my PhD was about starting the genetic test for Stargardt case here in Brazil. That time, the genetic test was a little far from the reality of the patients and the families. And it was just starting the new generation genetic tests that you already have today spread around the world. And at that time was the first machine here in Brazil. And we started with my PhD project. And I included that time 20 cases with Stargardt disease. And we did the genetic test to find there's variants in there to conclude the molecular diagnosis that time. And we we conclude most of them, but some stay with inconclusive or negative tests, and some years after we recheck some case that was negative or was inconclusive with Dr. Kramer's protocol, and it was able to conclude all of them. Most of the cases was ABCA4 cause of the disease. I have some two cases with PROM1 and one case of PRPGR. So that time was just how to start in genetic in molecular diagnosis here in Brazil for those cases was a really important time here for all the inherited retinal dystrophies. And today we know better how to do the molecular diagnosis for Stargardt case, because it become bigger and know where are all the most common and frequent variants. Nowadays, after 2 boys, I'm starting again to new work, and coming back with my group and the Stargardt patients to do like a natural history of all those cases. We are just starting, and we are planning to have the initial results that will be presented at ISGADAR meeting that will be in July here in Brazil. And then we will go on the work, and those works about natural history, they are really important because of all those tests to have new therapies or probably new treatments in the future for Stargardt cases. So that's my work. My everyday work is by the university. Stay there with all those fellows and seeing cases of different IRD diseases, and I'm helping and teaching them. And we have now I have a big group of ophthalmologists that are being specialists in retinal dystrophy, and it's become a big and solid group. And not only at the university, but I have my private practice at the by the Juliana Salles in her clinic, and I work too at the hospital. It calls Albert Einstein Hospital here in São Paulo. Is the biggest hospital here in Brazil. So I live in São Paulo, the huge city here in Brazil, and that's all about my ophthalmology life. Yeah. So I'm planning to talk about things that I saw at ARVO meeting. The ARVO is the Association of Research in Vision and Ophthalmology. It's a group that was founded in 1928 in Washington. And now this group have 75 countries enrolled, and it's how they say by their own, they are the largest and the most respected eye and vision research organization in the world. To be part of it, you can be a member, and nowadays they have around 10,000 research applied to the ARVO Association. Their mission is advanced research worldwide into understanding the visual system and preventing, treating, and curing its disorders. So this group, this association, it makes many works, and they are engaged in studies and fellows and around the world, and it's really important to connect all those peoples in the world. So it's starting in 1928 with 73 ophthalmologists. The membership is multidisciplinary from any specialist and students too, and consists in both clinical and basic researchers. The ARVO Foundation for Eye Research was established in 2001 and fundos novos research, education, and other initiatives to ARVO. The mission is to serve all global catalysts and innovation workplace development and collaboration in the field of vision research. So at the ARVO Association, we have 11 committees, and they work with all those questions, all those situations to make the things working. They have the advocacy and authors. They have a committee for animals and research. They have two awards committee. It's really important because it can help studies and students and small groups to continue in their works. They have a commercial relationship like any association. And one thing that is really interesting about the association is the continual medical education. It's a really interesting group, committee. They have the diversity initiatives to help many groups. Ethics regulations and in human research. We have the global members, because it's a huge association around the world. Professional development and the publications committee. By ARVO Association, by the ARVO Association, we have three really well-known journals. The Translational Vision, Science and Technology. The second is the Investigative Ophthalmology and Visual Science. We call it IOVS. And the third is the Journal Vision. All those three journals, they are really respected at the retinal disease and in any kind of retinal disease and study to be published a paper there, and they are really strong and good journals. So they concentrate many of the good papers in ophthalmology. So the ARVO promote an annual meeting in USA and promote a special the meeting and a special interesting group meeting that is virtual during all the year. They I'm sorry, they used to have an Asian ARVO every 2 years, but I'm not sure that they still have it. I think they stopped it by the pandemic time, and I didn't found any information about the next one. But they have the focus to be near every researchers, every group. So the ARVO meeting come each year, one by this side, one by the side, to get closer for around the world, and that Asia ARVO come through that time to be closer to the Asia area, but I just don't know if they will continue with that. And it's really interesting because when you are in ARVO meeting, we can see different people around the world, and it's the most exciting because everybody is talking about the same things. Everybody is looking for the same goal, to be better in vision, better in research for vision, to look forward things that can help, and it's really nice to be there. They hold this annual meeting in which professionals from different areas that work with ophthalmology meet and exchange experience and knowledge. From information technology, passing through technology applied to daily practice, going to artificial intelligence, as well as going from the formulation of research objectives, passing through the laboratory test, and arriving in protocols in living being in humans. Everything can be seen and learned at the ARVO meeting. So they promote this connections between research and students in the students placement program by the career and center connecting talent with opportunity. They connect all the countries by ARVO Connect. It's a really interesting chat that we can share information and we can find other specialists' works that we can be together. So in ARVO 2022 meeting in New Orleans, I have the opportunity to update about the Stargardt and ABCA4 studies. It was 3 weeks ago. One important section at ARVO meeting every year is the poster sections. There, we can find the students and know about the studies that will be presented in the future protocols. In those, focuses in Stargardt disease and ABCA4 gene, I saw students presented results of different approaches. That was natural history, that the main goals was natural histories, linkage from phenotype to genotype. That is like my work at my PhD time, I did this go-to. Different phenotypes from different ABCA4 gene variants and about how ABCA4 gene works and its interactions. All those posters are important to grow the knowledge of Stargardt disease, and it can draw the best moments to interventions in the future. About future interventions, it's possible to follow some laboratories' press release in their websites. So let's talk a little about those. At the Ascidian Therapeutics, they approach has the potential to treat patients with 1 dose of RNA exon editing therapeutic delivery in a single AAV vector. It's a viral vector that we, the science groups are using the viral vector to all the gene therapies. So for this work, with an RNA fragment, they use a rewriting RNA, and it is exon editing for patients with Stargardt disease and others ABCA4 related retinopathy, only for ABCA4 variants. They are working in vitro and in vivo. They present new 6 months of durability data.
Hi, Holly. How are you? She's in a room.
So the leading program targets in ABC for retinopathy, which demonstrate the most efficient and durable RNA exon editing via splicing ever reported in large animals. So they is just starting, and they show this initial found results. So it will be maybe a good option for the future in humans protocol. We need to follow them to see where it will be. Another pharmaceutical group, the Iveric Bio, have the Zimura protocol. It's a phase 2B randomized double masked controlled trial to establish this safety and efficacy of Zimura. It's a complement C5 inhibitor and trying to modulate the natural history of the disease. Compared to sham, that it's supposed to be treatment, it's not a treatment, we call sham, when we have to compare a treatment and a non-treatment case. This non-treatment case we call sham. So compare the treatment and the sham in subject with autosomal recessive Stargardt disease. And the inclusion criteria for this protocol is at least 2 pathogenic variants in ABCA4 gene, confirmed as one of the criteria. They are with open protocol, and it will be concluded in 2024. So we can be looking at them and see how it will be good or can be included for the future treatments. Another pharmaceutical group, it's a Sanofi clinical trials, and they already published some results, and the paper called 3-year safety results of SAR 422459 gene therapy in patients with ABCA4 associated Stargardt disease, and open label dose escalation phase 1/2A clinical trials, accord 1 to 5. And in that paper, they explained that it was a subretinal gene therapy that delivered a subfoveal retina of the as the extrafoveal retina. So during the protocol, they identify some adverse events and some about the drug delivery, some about the eye condition with the drug, but we need to look forward. And the purpose of this work is to include only ABCA4 Stargardt case and show the data about subretinal treatment. And but as the results, they said that no clinical significant change in visual function tests were found to be attributed to the treatment. So they still working on it, but the technology is already domain, and so we need to look forward where they will go. Another kind of possible treatment is a oral drug, and we was working on a mixostat versus placebo. We did this protocol here in Brazil too, and it was concluded in 2022. The phase 3 multicenter randomized double-masked study comparing the efficacy and safety of emixustat and the placebo. So this treatment, they already published a press release by their website in 2020, before the concluding time in 2022, and they was explaining about the drug. It's a drug that modulates another gene, the RPE65, that is in the RPE cells, and trying to modulate and reduce the visual circle to see if this lentifier visual circle can be less toxic to the retinal cells, and then to see if it can change the natural history of ABCA4. So they concluded in 2022, and we just needed to see if they have any new press release or any publication, any paper about it. So just stay to see what they have to say. So for the future, we are looking to the possibility of optogenetic therapy. It's a new goal. It's about treatments that can modulate retinal cells functions, giving them new functions of modifying their system and make them live longer. This optogenetics planning to turn in a photoreceptor different cells from the cones and rods. So it's a new phase of genetic therapy, and I think for the future we have good and hope we have a good results about this kind of therapy. So an important knowledge that grew in the last years about ABCA4 were that this gene is really tricky. In improving the gene studies by technology and dedication to found the second variant and in this gene, like Kremer's protocol, helps a lot to conclude Stargardt molecular test diagnosis. As we know, most of studies has in their inconclusive all the protocols have in their inclusion criteria a conclusive molecular test. So it makes possible to patients to be included in protocols and in their future treatment. So that's all about my work, about ARVO, about the protocols rolling on. And I really want to thank you a lot for the opportunity to be here with you all. And it was really a pleasure. And I'm here for some questions.
Okay, thank you very much, Dr. Salles. Maria, did you want to go through the chat?
Yes, please, if I could. There's a few questions here, Dr. Salles.
Mm-hmm.
They're a bit technical, so I might have to read them. The first one is from Julika, who's had to leave, but she's left two questions. The first one is, she's heard about the influence of the genetic background of people, and that the eye tries to find ways round to get rid of the lipofuscin, e.g. through the ABCA1, etc. Do you know anything about this?
Let me find the who did the question? Julika, yeah?
Julika. It's about 3 up from the bottom.
So we don't have any result about how the lipofuscin can be really interviewed by the natural history. We know that it works in eye tissue, and it's important for all the retinal cells functions, but I really didn't find any information about how it will be like a new protocol or a new study or a new including information about those. But we know that this is important for the retinal works.
Okay, thank you very much. There's another question, which is about epigenetics.
Yes.
So the question is, can the new science of epigenetics, for example, via the increasing the readability of the ABCA4 or other genes that play a role, serve to slow down Stargardts by making sure that the remaining ability to produce the transporter protein is maintained as long as possible?
Mm-hmm. So the epigenetic is a different way to modify the natural history. It will not active the ABC4, strictly the ABC4 gene. It's a different technology. They're trying to turn in photoreceptors some different cells of the retina. So if we think we don't have all those answers because it's just starting. But if you in the future receive optogenetics therapy that will act like in your ganglion cells or in your Miller cells, the ABC4 gene will stay working like all your life in your original photoreceptor cells like cone and rods, but the optogenetic will turn those other cells in a new new photoreceptor. And this mechanism we don't have clarified how it will work, because this cell is different from the cone and rod where the ABCA4 works, you know. And that's why we need to learn more about how the optogenetics can turn, how this ability to be a photoreceptor will be different from the original cells. So, and because it's not a turning let's see how to explain. It's not to turning the gene sequence from the patients to become working, because the cell function, the cell RNA is different. So it's the way is to include a new mechanism for this cell. So yes, the ABCA4 is still working wrong in those different cells, but maybe it will not be used for them. Make it clear? It's a little hard because for all of the genetic information, we must know that different cells work differently, and the optogenetics try to give a new function for that cell, and not start to become equal a cone or a rod. So it's a molecular, it's a little difficult.
Thank you so much. I think we have an incredibly interested and well-informed audience. So there's a few more questions coming up about studies. So Anna has asked about two studies in particular. One is the nanoscope study, and the other is the Alkeos study and the results of that. Do you know anything about either of those two?
So the nanoscopes, I didn't find any information on the internet that I can inform. We are listening about those, and so we need to wait. And the Alkeos was a work that was going well, and I didn't find any new information because I think it's because of the pandemic time. And in ARVO too, I was looking for them and I didn't find something new. But we know that all those companies are coming back with those studies. They make all the studies little slower those past years. So we need to wait for new informations. Your mic is closed, Ria.
Thanks for letting me know. So it's a further question from Anna. For those with inconclusive results, is the genetic tests that you were mentioning at the beginning of your talk available? And I'm not sure which country Anna is in, but that might vary from country to country.
Yeah, it's varied, and all those studies to become conclusive molecular tests will they were being included in a normal genetic test nowadays. So if you have an old genetic molecular test, an old around 2014, 2015, if your molecular test is from that time, and if you did nowadays in a solid group, maybe it can be concluded, because all those knowledge about ABCA for different areas that can have variant that was no known in the past. Nowadays they're all included in a good pool of genes and regions for to make it conclusive. So if you did in the past, I suggest to did it now again. We have around the world good labs that can make it conclusive. But if you have in the past you have no known ABCA for variants, must be attention to other genes too. So if you did a huge panel of genes and regions, maybe it would be better to conclude your case.
Thank you for that. Anna is actually from Brazil, so that's quite helpful. And I know that at our conference a month ago, there was a lot of interest in genetic testing from everybody around the world. And I think maybe we need to do a little bit of research to try and find out what might be available in different countries and how to lobby to get genetic testing right for people with Stargardt. So that's really helpful. Thank you. There's no more questions on the chat that I can see. So I'll hand back to Bhavna.
Thank you very much, Dr. Salles, to come this morning. Really, really informative. Well, morning for you, really informative, really interesting. If there are any other questions, maybe you can sort of send them over and I can sort of post them over to Dr. Salles. And I think we're going to conclude. I know you have to leave in a little while, Dr. Salles. So thank you so much. Really, really informative and really hopeful as well to know that there's so much research around, you know, for Stargardts. So I'm going to stop the recording.
Thank you a lot, everyone.